Here's a situation that plays out constantly, and nobody warns you about it ahead of time. Someone turns 65, Medicare kicks in, and they get flooded with mail. Glossy brochures, phone calls, television commercials with smiling older people on beaches talking about $0 premiums and free dental and gym memberships included. And it sounds incredible. So they sign up for a Medicare Advantage plan because, honestly, who would not? It sounds like the better deal by a mile. Fast forward 3 years, they get a serious diagnosis. They need a specialist. They need a specific hospital. And suddenly, they are discovering that their plan does not cover that specialist. That hospital is out of network, and the prior authorization they need to get the treatment their doctor recommended has been denied twice. They are sick, they are scared, and they are fighting an insurance company at the worst possible moment of their life. Meanwhile, their neighbor who pays more every month for a Medigap plan walks into any hospital in the country that accepts Medicare, sees any specialist they want, and has almost none of that fight. Same Medicare, completely different experience. If you are approaching 65 or already there, and you have not fully understood the difference between these two options and the trap hiding inside the more popular one, this video is for you. Let's get into all of it right now. First, let's make sure we understand what we are actually comparing because the names alone cause confusion. Original Medicare is Parts A and B. Part A covers hospital stays, and Part B covers doctor visits and outpatient care. Original Medicare is solid, but it has gaps, meaning it does not cover everything, and it leaves you with cost sharing like deductibles and coinsurance that can add up quickly if something serious happens. The two main ways people fill those gaps are Medigap, also called Medicare Supplement Insurance, and Medicare Advantage, also called Part C. These are not the same thing dressed up differently. They are fundamentally different structures for how your healthcare works in retirement, and choosing between them is one of the most consequential decisions you will make as you enter this phase of life. Let's start with Medigap, because this is the one most people understand less, even though it is in many ways the simpler of the two. Medigap is a supplemental insurance policy you buy from a private insurance company that works alongside Original Medicare. You keep your Original Medicare, you add the Medigap plan on top of it, and together they cover most of what Original Medicare leaves uncovered. The most popular Medigap plan, Plan G, covers essentially everything except the Part B deductible, which in 2025 is $240. After that deductible, for the rest of the year, your out-of-pocket costs for covered Medicare services are essentially zero. You can see any doctor or specialist in the country who accepts Medicare, which is the vast majority of doctors. You can go to any hospital that accepts Medicare, and you do not need referrals. You do not need prior authorizations for most services, and you do not have a network that tells you where you can and cannot go. The trade-off is the monthly premium. A Medigap Plan G policy typically runs somewhere between $100 and $180 a month, depending on your age, your location, and the insurance company you choose. Add the standard Part B premium of around $175 a month, and you are looking at a total Medicare cost of roughly $275 to $355 a month before prescription drug coverage, which you add separately through a Part D plan. Now let's talk about Medicare Advantage and why it looks so attractive on the surface. Medicare Advantage plans are run by private insurance companies that receive payment from Medicare to cover your benefits. Instead of Original Medicare paying your claims directly, the Advantage plan handles everything. And these plans are often marketed with very low or $0 monthly premiums, added benefits that Original Medicare does not cover like dental, vision, hearing, and gym memberships, and the simplicity of having everything bundled into one plan. For someone staring at a Medigap premium of $150 a month versus a Medicare Advantage plan with a $0 premium and extra perks included, the Advantage plan looks like a genuinely easy choice. And for some people in some situations, it genuinely is a reasonable choice. But here's the trap that the glossy brochure does not put on the front page. Medicare Advantage plans use networks. HMO plans require you to use doctors and hospitals within the plan's specific network, and generally require referrals from a primary care doctor to see a specialist. PPO plans have networks too, but allow out-of-network care at a significantly higher cost. If your doctor is not in the network, you either pay out of pocket or find a new doctor. If the hospital you need is not in the network, same problem. And networks change. A doctor who was in your plan's network when you enrolled may not be in it next year. The plan reviews and adjusts its network annually, and you find out about the changes in the fall during open enrollment, often buried in a document called the Annual Notice of Change that most people never read carefully. So the plan you picked because your doctor was included may not include that same doctor 12 months from now, and you may not find out until you need care. The second piece of the trap is prior authorization. Medicare Advantage plans frequently require prior authorization for procedures, specialist visits, hospital stays, and treatments. Prior authorization means the insurance company has to approve the care before you receive it, and insurance companies deny prior authorization requests regularly. The issue is not that denials never have merit. The issue is that when you are 68 years old and your doctor says you need a procedure and the insurance company says not yet, you are now in a fight that requires time, energy, paperwork, and sometimes lawyers or patient advocates to resolve. Sick people fighting insurance companies for care they need is not a hypothetical. It is a documented, well-reported reality of how Medicare Advantage plans operate in practice, and it is the piece that almost none of the marketing mentions. The third part of the trap is the one that catches people most permanently. Switching from Medicare Advantage back to Medigap after the initial enrollment window is not always possible, and when it is possible, it is not always easy. Here is why this matters so much. When you first turn 65 and enroll in Medicare, you have a 6-month open enrollment window during which insurance companies must sell you any Medigap plan they offer at standard rates without being able to deny you or charge you more based on your health history. That window is gold. Once it closes, in most states, Medigap insurers can use medical underwriting to decide whether to sell you a policy and at what price. If you developed a serious health condition while you were on Medicare Advantage, you may find that switching to Medigap is either unaffordable or completely unavailable to you because no insurer will accept you at a reasonable rate. So the person who picked Medicare Advantage at 65 because the premium was zero is now 72, has a health condition, wants the flexibility and predictability of Medigap, and cannot get it. The decision made at 65 when they were healthy and the choice seemed simple has now become permanent in a way they never anticipated. So who is Medicare Advantage actually right for, and who should be choosing Medigap? Medicare Advantage tends to work better for people who are in good health, have lower healthcare utilization, live in an area with a strong network of providers in the plan, have limited financial resources, and genuinely cannot afford a Medigap premium, and are comfortable navigating network restrictions and prior authorization processes. In those specific circumstances, the lower out-of-pocket costs and added benefits can make Medicare Advantage a reasonable fit. Medigap tends to be the stronger choice for people who want maximum flexibility in which doctors and hospitals they can use, who travel frequently and want coverage that works anywhere in the country, who have existing relationships with doctors and specialists they do not want to lose, who have or anticipate significant healthcare needs, and who value the predictability of knowing their out-of-pocket costs are essentially capped once they hit their annual deductible. The monthly premium is higher, but in a year where something serious happens, the math often flips dramatically in Medigap's favor because the out-of-pocket maximum on a Medicare Advantage plan can reach several $1,000s, while the Medigap enrollee is paying close to nothing after their deductible. Here is the practical move that this entire video is building toward. If you are approaching 65 and still in that initial enrollment window, do not let the $0 premium be the headline that makes the decision for you. Sit down and think honestly about your health, your doctors, your travel habits, your risk tolerance, and what the experience of navigating prior authorizations and network restrictions would actually feel like if you needed serious care. Talk to an independent Medicare broker, not someone who only sells one company's products. Someone who can walk you through the options side by side with your specific situation in mind. The choice you make at 65 during that open enrollment window is one of the most consequential healthcare decisions of your retirement, and in most states, it is significantly harder to reverse than it is to get right the first time. The hidden trap of Medicare Advantage is not that it is a bad product. It is that it is a product sold primarily on the features it adds, while the features it removes or restricts stay in the small print. Understanding both sides of that equation before you sign is the entire job. Now you do. If this helped you see a decision you are about to make with clearer eyes, share it with someone turning 65 who needs to hear it before they sign anything. We are a small channel just working toward our first 1,000 subscribers, and if you found this useful, hitting subscribe genuinely helps us keep going. Thank you for watching all the way through. The next video is right there on your screen, and I will see you there.